Let's get right into it. So, your private health information may already have been leaked. So, I've had multiple conversations with many patients over the last, I don't know, 6 months, and I've been absolutely shocked how many otherwise very privacy focused patients have already uploaded their information to ChatGPT or even other AI apps like Claude. While AI tools have certainly revolutionized how we interact with information, especially in my practice, I can understand why patients would do this, because who would want to have a second opinion from their doctor? The problem is that these AI apps do not protect your information. So, why use AI in the first place? Well, it turns out that most patients um, they don't 100% trust their doctors or the information that they're getting, and I do not blame them. 100% agree with that. I think it's fantastic that people are always checking, because if you went to your mechanic and the mechanic said, well, your umpty generator is out of whack and that's going to be a $12,000 replacement, you'd probably get a second opinion, right? I'm sure I would. I know I would. So what I found out ever since these AIs really kind of exploded on the scene in 2024 is that more and more patients around the world are turning to ChatGPT and other LLMs. It's just a fancy term. It means large language model, which is what ChatGPT, Claude, and a lot of these other AIs really are. And it's fast, it's smart, it's free or relatively cheap, but unfortunately, it isn't really safe in terms of privacy. And as a doc, I completely understand the appeal, but the risks for your privacy are very serious. Okay. So, what happens when you upload medical data to ChatGPT? You think it gets analyzed and then it disappears? Not at all. So, surprise, surprise, ChatGPT is not what we call a HIPAA compliant platform. According to OpenAI's own documentation, any data at all that you enter or upload to ChatGPT can be used to improve their models unless you explicitly opt out. In other words, they have no obligation to protect your health information. And Sam Altman, the founder of ChatGPT, has definitely talked about this in multiple interviews. So this is, at least in the AI world, this is really well known. So what does this mean to you? It means your private health information, labs, diagnoses, any medications, treatments, any notes or discussions with your doctor of very private information, is just uploaded into the ChatGPT cloud, and anybody can access it. It can be a third-party engineer, third-party contractor, and not your doctor. And to me, that's a huge red flag. We've seen ever since technology really burst on the scene with the internet back in the 90s, I know ancient times, data breaches have been a fact of life. Okay, so um, why does this happen? Okay, and why is ChatGPT not obligated? Well, first of all, ChatGPT doesn't follow the same legal obligations as your doctor because it doesn't have to protect your information like your doctor should. And why do doctors have to protect information? There's this really horrible acronym called HIPAA. It stands for the Health Insurance Portability and Accountability Act. It's a federal law which mandates that all people who manage what we call protected information, so medical care, diagnoses, medical visits, even anything related to your health, we are obligated to protect this information, and ChatGPT does not. Okay, until and unless they're required to, and until and unless they sign something called a BAA or a business associate agreement, there's no obligation to protect their information. And so ChatGPT, just so you know, doesn't ever get rid of information. It's just there somewhere in a database. Okay. So you may be asking, well, gee, what's the real risk for this data breach? Okay, and if you're ancient like me, not really ancient, but you know what I mean, you've seen data breaches happen every year, ever since the internet became a thing, right? As a former Intel guy in the Marine Corps long ago and far away, data information breaches were distressingly common, and we would exploit that in the Marine Corps and in the intelligence world to get information, open source information. You'd be shocked at what people don't even think twice about putting out there for anyone to access, right? In 2023, multiple companies, including Samsung, accidentally exposed proprietary and sensitive data by pasting it into ChatGPT. Now imagine you do that with your medical information. What if someone decides to go and scrape everyone's health information from the ChatGPT databases? What are you going to do about it? Not much, right? In fact, just in the last 10 years, there have been so many data or health related data breaches that it's estimated that 100 million Americans have been exposed. That's 1 in 3 Americans, which is kind of crazy. So the next question is, are there any safe alternatives? And the answer is, as far as I know, no. Sorry, not really. There are AI platforms or AI tools within electronic medical records, such as what I use, and your other doctors use hospital systems, but they're very primitive at this point. They're not really robust, and they're definitely not open to the public. So what can you do? Well, if you want to use AI support for interpreting medical data, you might want to actually consider going in and manually depersonalizing any identifying information on any piece of information that you might upload. So for one way to do it is to go into Adobe Acrobat, the paid version, and start manually deleting any identifying information. Also, as a side note, side quest, when you upload PDFs into any chat GPT, there's this process where the AI has to read the PDF data. It's a procedure called Retrieval Augmented Generation, or RAG for short. The problem is that RAG is not clean, and it often hallucinates or just makes up data. So anytime you do this, even if depersonalized, make sure to double check the data that you're feeding into the AI to make sure that it's actually accurate, okay? And the last thing to remember is that even if the AI seems smart, which they're pretty good at noticing patterns, they're not a licensed clinician. And so oftentimes these AIs will say things that don't make any actual sense in a clinical context or in your particular context, because while most humans or all humans work in the same physiologic, sort of manners, everyone's sort of individualized health environment is unique, and reading in someone at 25 is nothing, but at 55 or 65, it's completely different and more significant, okay? So use this information if you're going to. Use it in a safe manner if you're going to. Don't be afraid of it, but be cautious about it. And then take that information and discuss it with your doctor. And just tell your doc, hey, listen, as doctors, we've heard for years all that, I looked it up on Google and it told me I'm going to die of cancer, when you're there for a cough. So be happy to, when you talk to your doctor, just say, hey, I've got this through ChatGPT. What do you think? And your doctor should not be offended by it, just as a little side note. So if any doctor or nurse practitioner, anybody who's your clinician gets really upset about it, don't that's a big red flag. Like, it can definitely sort of guide the conversation, but the physician or the clinician should be smarter than the AI even now. And so they should not take offense to it, okay? Anyway, I'm Dr. Pete Cashio, and I hope you found this video useful. Let me know if you did. Subscribe, give me a like, share it with your friends. Peace.